The number one question I get from men online and in my clinic is this: Doctor, is there anything I can do to get bigger? Sometimes it's phrased as, how do I get longer? Or is there a way to add girth? And I get it. This is a deeply personal topic. But here's what I want you to know. You are not alone in thinking about this. A massive international survey of over 50,000 men found that more than half, 55%, were unhappy with the way their penis looked. But here's the twist. When their partners were asked, 85% of women said they were satisfied. That gap between how we feel about ourselves and how our partners actually see us is real. And it matters because this isn't just about numbers on a ruler. It's about confidence, intimacy, and dignity. Before I unpack the science, do me a quick favor. Hit the like button if you value honest, no-nonsense health talk. Drop a comment and tell me where you're watching from today. And of course, subscribe to this channel because every week I share new science-backed strategies for men's health, intimacy, and vitality. Let's start by busting one of the biggest myths out there. Pornography has completely distorted our sense of what's normal. What you see on screen is not reality. It's performance, often altered by camera tricks, surgery, or drugs. The real-world, medically measured truth is this. The average erect penis length is about 13.2 centimeters, or just over 5 inches. And medically, anything within a broad range around that number is considered normal. Here's another fact. A micropenis, which is a true medical condition, is defined as a stretched or erect length of less than 7.5 centimeters, or about 2.9 inches. That's extremely rare, affecting only about 0.14% of men worldwide. So if you're not in that category, biologically speaking, you are normal. But here's the catch. Most men who worry about their size aren't really struggling with length. They're struggling with anxiety about length. It's so common that doctors actually have a name for it: small penis anxiety. And here's why that matters. Because the more you obsess, the worse it can affect your mental health, your relationships, and even your ability to perform. Hi, I'm Dr. Victoria Adams, a board-certified urologist and men's health specialist. I've been helping men protect their prostate, restore their vitality, and improve intimacy for over 12 years. And part of my job is separating science from hype. Today, I'm going to break down what the medical research really says about penile length, girth, and enlargement treatments. We'll cover the real averages and why they matter, the mistakes men make chasing risky or fake fixes, and yes, the few scientifically tested methods that can make a measurable difference. I'll also share what I tell men in my practice who come to me worried about this exact issue. Let's go through the most common approaches men try, from the least helpful to the ones with actual science behind them. Mistake number 1, falling for scams and quick fixes. Everywhere online, you'll see ads for miracle creams, pills, or shady injections. They promise dramatic gains in length or girth. But here's the truth. There is zero clinical evidence that pills or lotions can make your penis longer. Biologically, here's why. A cream cannot penetrate deeply enough to alter connective tissue or smooth muscle structure. Pills marketed for size usually just contain herbs that mildly increase blood flow, at best giving you a stronger erection, not a bigger organ. And emotionally, falling into these traps sets you up for disappointment, wasted money, and sometimes dangerous side effects. As a physician, I've seen too many men come into my office frustrated and ashamed after spending hundreds of dollars on products that never had a chance of working. The supplement industry preys on insecurity, and I want you to be smarter than their marketing tactics. Mistake number 2, ignoring the mental side, small penis anxiety. I want you to pause and ask yourself, am I chasing size or am I chasing confidence? Because studies show that when men with size anxiety receive psychological counseling without any physical treatment, most of them stop feeling the need for enlargement at all. That's powerful. Think about it. If your partner is already satisfied, the real victory might be learning to see yourself through their eyes. Biologically, your body isn't broken. Emotionally, the anxiety convinces you otherwise. And practically, investing in therapy could save you years of stress, money, and risk. In my practice, I've had countless conversations with men who believed their size was ruining their relationships. When we dig deeper, the issue is rarely anatomical. It's psychological. The shame, the comparison, the constant measuring, these behaviors don't lead to satisfaction. They lead to isolation and self-doubt. If you're spending mental energy worrying about this, I encourage you to speak with a therapist who specializes in body image or sexual health. That single step could transform your intimate life more than any device or procedure ever could. Option number 3, penile traction devices, extenders. Now we're getting into the only non-surgical treatment with consistent scientific evidence. Penile extenders are mechanical traction devices. They apply a steady outward pull over time, like orthodontics for tissue. In clinical studies, men who used them for several hours a day for months gained an average of about 2 centimeters in stretched or flaccid length. That correlates closely to erect size. But here's the trade-off. It requires daily dedication for months. Side effects can include bruising, numbness, or no results at all. And the gains are modest, not the dramatic changes the ads promise. Biologically, it works by stimulating micro-stretching and tissue adaptation. Emotionally, you need patience. It's not a quick fix. Practically, it means wearing a device for hours every single day. I tell my patients this: if you're committed to the process and have realistic expectations, traction therapy can provide measurable results. But you must understand what you're signing up for. This isn't a 2-week solution. It's a 6-month minimum commitment with daily discipline required. Option number 4, vacuum pumps for erectile dysfunction, not enlargement. Vacuum erection devices create temporary engorgement, but here's the truth. They do not increase length permanently. Their role is medical, helping men with erectile dysfunction maintain firmness for intimacy. If anyone sells you a pump for permanent enlargement, walk away. These devices have legitimate uses in urology. I prescribe them regularly for post-surgical rehabilitation and ED management. But enlargement is not one of those uses. The temporary swelling you experience from a pump is just that, temporary. Within hours, everything returns to baseline. Any company claiming otherwise is misleading you for profit. Mistake number 5, dangerous injections and unregulated surgeries. This is the darkest corner of the enlargement world. Some clinics and even unlicensed providers abroad offer injections of silicone, oils, or fillers into the penis. The risks are severe: tissue scarring, chronic pain, erectile dysfunction, even deformity decades later. I've treated men who traveled overseas for cheap procedures and returned with complications that required multiple corrective surgeries, sometimes with permanent damage. And surgeries like ligament release, skin grafts, or cartilage implants, they may make the penis look longer when flaccid, but they do not increase functional length. Complications are high. Patient satisfaction is low. Bottom line, unless you're in a regulated clinical trial for a true medical condition like micropenis, surgery is not recommended. The risk-to-benefit ratio simply doesn't justify it for the vast majority of men. I cannot stress this enough. Your penis is not a cosmetic feature to be altered by unqualified practitioners. It's a functional organ essential to your health, pleasure, and fertility. Treat it with the respect it deserves by avoiding anyone who promises dramatic results without discussing the very real dangers involved. So, what do I actually recommend to my patients? Get the facts, measure properly, understand what's normal, and remember the survey. Your partner is likely more satisfied than you think. When I sit down with a patient concerned about size, the first thing we do is establish reality. I ask them what they believe is average, and almost universally, they overestimate. Pornography and locker room comparisons have created a completely distorted picture. Once they understand the actual statistics, that they're likely well within normal range, a significant portion of their anxiety dissipates. Knowledge is power, and accurate knowledge about your own body is foundational to making good decisions. Address anxiety first. Consider counseling because confidence is often the real missing piece. I refer many of my patients to mental health professionals before pursuing any physical intervention. Why? Because if the issue is psychological, and it usually is, no physical change will provide lasting satisfaction. You could gain an inch and still feel inadequate because the problem was never truly about length. It was about self-perception. Cognitive behavioral therapy, in particular, has shown excellent results for men with body image concerns. It helps reframe negative thought patterns and builds genuine, lasting confidence that no device or surgery can replicate. If you still want a physical option, traction therapy has the best evidence. Just know it's a long, patient process, not an overnight transformation. For men who, after counseling and education, still want to pursue enlargement, I discuss traction devices honestly. I explain the time commitment, the modest expected gains, and the importance of following protocols exactly. We set realistic goals and check in regularly to monitor progress and address any side effects. Focus on what you can control right now. Optimizing blood flow through exercise, diet, nitric oxide support, managing hormones, reducing stress, improving overall sexual health. Here's something many men don't realize. The quality of your erections has far more impact on sexual satisfaction, both yours and your partner's, than length ever will. A firm, reliable erection achieved through cardiovascular health, proper nutrition, and stress management will serve you better than any enlargement attempt. Nitric oxide is your friend here. This molecule is essential for the blood vessel dilation that creates erections. You can support its production through foods like leafy greens, beets, and citrus, as well as through regular aerobic exercise. Hormone balance matters too. If your testosterone is low, your libido, erectile quality, and overall vitality will suffer. Get your levels checked and work with your physician to optimize them naturally or through appropriate medical intervention. And never underestimate the impact of stress. Chronic stress floods your body with cortisol, which directly interferes with sexual function. Finding healthy ways to manage stress, whether through exercise, meditation, hobbies, or therapy, will improve your intimate life more than most men expect. Because here's the truth. Most partners care less about size and far more about energy, confidence, and intimacy. When I speak with couples about sexual satisfaction, the woman's concerns are rarely about her partner's dimensions. They're about connection, about feeling desired, about their partner being present and engaged, about adequate foreplay and emotional intimacy. The men who have the most satisfying sex lives aren't the ones with the largest measurements. They're the ones who show up fully, confident in themselves, attentive to their partners, and focused on mutual pleasure rather than performance metrics. Listen, my friend, your worth is not measured in inches. Your partner doesn't see you the way you see yourself in the mirror. And science shows us that men who focus on overall health, confidence, and connection have far more fulfilling sex lives than men who obsess over size. So if you're worried, don't carry that burden in silence. Talk to your doctor, talk to a counselor, and remember, your body is not broken. I've had patients sit across from me convinced they were inadequate, only to discover they were perfectly normal. The relief in their eyes when they finally accept this truth is profound. I want that relief for you too. At the end of the day, you don't need to chase risky procedures or empty promises. Small, smart, evidence-based steps like traction therapy, blood flow optimization, and addressing anxiety can make a bigger difference than you think. And the real key to satisfaction? It's not just size. It's confidence, intimacy, and showing up fully present. So take care of yourself, respect your body, and know that your best years of vitality and intimacy are not behind you. They can be ahead of you. The path forward is clearer than you might think. Start by getting accurate information about what's truly normal. Challenge the distorted images that media and pornography have planted in your mind. Recognize that your anxiety may be doing more damage than any physical attribute ever could. Invest in your mental health. A few sessions with a qualified therapist can reshape your entire relationship with your body and with intimacy. This isn't weakness, it's wisdom. Optimize what you can control: your cardiovascular health, your hormone levels, your stress management, your presence during intimate moments. These factors contribute more to sexual satisfaction than anything you can measure with a ruler. If you pursue physical options, stick to evidence-based approaches, traction therapy with realistic expectations, medical-grade vacuum devices for erectile dysfunction if appropriate, and always work with qualified medical professionals. Avoid the scams. Avoid the dangerous shortcuts. Avoid anyone promising miraculous results. Your health and safety are worth more than any promised gain. Remember this: satisfaction in intimacy comes from connection, confidence, and genuine presence, not from conforming to unrealistic standards. The men I see who struggle most with intimacy aren't struggling because of their anatomy. They're struggling because they've convinced themselves they're not enough. That belief becomes a self-fulfilling prophecy, creating anxiety that interferes with arousal, performance, and connection. Breaking that cycle starts with accepting yourself as you are, while also taking positive steps to optimize your health. It's not about complacency, it's about directing your energy toward changes that actually matter. If this video helped, please hit that like button so more men can find this information. Comment below. I'd love to hear your thoughts. And subscribe to this channel for weekly science-based tips to help you thrive at every age. Until next time, I'm Dr. Victoria Adams, reminding you, your value as a man is so much bigger than numbers on a ruler. Take care of yourself, because you're worth it.